Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Arun Kumar M. He is a pediatric and adolescent endocrinologist. He did his graduation in MD from Delhi University, and then he did his MD from Rishikesh AIMS, and later on he worked in Lady Harjing Hospital also. And apart from that, now he is working in our own Mysore Chalvamba Hospital, and he's a very renowned pediatric endocrinologist. But today he's going to tell us on ORS, because this is the summer and the rainy season has started, and the children are likely to get loose motions and vomiting. So, welcome, Dr. Arun Kumar. Please tell us what is this ORS and what is the week, ORS week.
Thank you. Thank you, madam. As you rightly said, now this is the season where children tend to get GI infections. We call it as loose motions, diarrhea, dysentery. So here, in every year, in from July 25th to July 31st, we celebrate something called as World ORS Week. So in this period, we try to educate parents and the common public regarding the usage of ORS because it is a very cost effective treatment which can save lives. So, from July 25th to July 31st is the World ORS Day. So, you might ask, so where the ORS is used and what is its implications, where and all.
And how it started and who started first.
Yeah. So, ORS is being used for mainly for the diarrheal diseases, for the loose motions. So, why we should use ORS in loose motions? Because as the name indicates, it's loose motions. The motion should have a specific consistency. That means the water content should be in a specific amount because the human body is made of majorly by water, 60 to 70%.
Almost 60 to 75% is water.
Yes. In children, it is more actually. So when there is a loose motion, the more of water content is lost in the stools. So once the water content is lost in the stools, and when we are not replacing it, body will go into something called as dehydration status. It is loss of water. So there is a negative deficit of water inside the body, because of which body will suffer a lot of issues. ORS is the one which can save child's life from this major disaster. If we see the statistics in children less than 5 years of age, if 100 children die, up to 15 children will die because of this diarrheal illness, because this diarrheal illness will worsen and they will cause multi-organ dysfunction. So the main thing is it is purely preventable disease. If we just give a rehydration in simple form of ORS, we don't need a doctor, we don't need a big hospital facility, nothing. Mother has to just take the ORS packet, put in water and give to the baby. So this can save the life of the baby. That's why we want to create awareness among the public, among the parents, that what ORS can do and how to use that and when to use it.
Okay. On a war footing, you can start the treatment so that the child doesn't go into complications of dehydration.
Yes.
Very good. Who started it first in the world? Is it
Yeah,
Indian
so-
or
Yeah, before 1950s there was no concept of ORS actually. So before that, the treatment for dehydration or diarrhea was just a IV saline.
Intravenously, glucose bottle used to be saline bottle. They
You
used
start
to
the drip and the patient will get rehydrated.
Yes.
But Dr. Hemendra Chatterjee, who is an Indian doctor and scientist, he thought that how we can use a cost-effective thing. So he tried to give salt and water through the oral route so that few patients got improved. But because of the non-availability of the research that time, that concept stayed bit low for a few years. Later, some Western scientists found out that our intestines have something called a special gate that is called a sodium glucose co-transporter. The speciality of that is, despite diarrhea, if you give specific amount of sodium, specific amount of glucose along with water, it will absorb everything like a pump. It will absorb everything. It will replenish
like
the
sucking
body.
the thing.
Yes. Okay. So it will replenish the body. The rehydration can be done in a very simple way. You don't have to wait till you reach to the hospital. So after that, this treatment was used in patients of cholera. Cholera was the biggest threat to the human.
I know they used to die. So I mean, especially until the vaccine and the IV fluids were not there, They were dying like anything.
Yeah, whole village used to get vanished because of the
Vanished,
cholera.
totally vanished.
So
Yes.
now we rarely listen to the word of cholera
Yes.
because of the help of this
Vaccination,
and
yeah.
the ORS and the clean sanitation, definitely. So that's why in the cholera and diarrheal disease they started using ORS. Now WHO has clearly made a standard ORS packet where we can use in all the age group. From the small children till the age of 70 years, 80 years, we can use ORS without any fear because it is a very safer option for rehydration till the patient reaches to the hospital.
Oh, that's very nice. But how the parent should know that the child is going for dehydration? And what are the causes other than gastroenteritis? What are the causes of dehydration?
So if we come to the causes of dehydration, the major cause is the loose motions and the vomiting. We call it as gastroenteritis. Other than that, if the child is not well, he is having fever because of the illness, child is taking very less. That time also child can go for dehydration. And during the summer seasons, because of
Heat stroke, yeah.
heat stroke, they can get dehydration. So during all those times, if the patient is able to take orally, we can always use ORS for the replenishment of the electrolytes and water.
Okay.
And the
Now,
signs
suppose the ORS is not available, they are traveling. Can they prepare themselves at home?
Yeah. Before coming to that, I will just complete that
Okay.
signs of dehydration also. So signs of dehydration will be just like your face will be completely ನಮ್ಮಲ್ಲಿ ಕನ್ನಡದಲ್ಲಿ ಬಾಡ್ ಹೋಗಿರುತ್ತೆ ಅಂತ. So the child will be lethargic. He will not be very active like before. The child's oral mucosa, tongue looks very dry. Usually, if we see our tongue and eyes, they will
the eyes will be sunken eyes.
It looks like the eyes have gone inside. And even if the child is crying, there are no tears, and the child is passing less amount of urine compared to before.
Which is high colored.
Which is high colored. So if these signs are there, that means that the body is deficient in water. The child is in dehydration. You should immediately start the ORS if the child is taking orally, or else you should bring the child immediately to the hospital.
Okay.
And the next question is how to prepare at house. Sometimes, like now these days, in most of the places, we get the commercially available WHO standard ORS in the packets. It comes in a small pouch, and pouch will have powder, and they have to mix it with the water. There are so many commercial preparations which will have a Tetra Pak and all. Usually, we don't use the Tetra Pak and all in children. The reliable one is the pouch one, which written as the WHO standard ORS.
Okay.
So if we don't have that at the house, for the emergency purpose, we can prepare at the house because this ORS contains sodium, glucose, citrate, and chloride. This can be procured at the house in the form of salt, sugar, and nimbu.
And lemon.
Lemon. So in specific proportions we have to put. So 6 spoons of the glucose and half spoon of the salt with 2 to 3 drops of the lemon juice. So this will
1 liter of
1 liter of
boiled cold water.
Boiled cold water. So it is very important. So this is the specific proportion of the water and specific proportion of the salt and sugar we need to mix to prepare homemade ORS. We can give this ORS for the emergency purpose till we reach to the hospital or the standard ORS is available.
Okay. And this is less expensive, and technically you need not be trained doctor.
Yes.
And then there is no question of IV fluid and then infection also, direct infection. That also is not there. So I think, during this summer and the monsoon season, let all the parents be aware what has to be done, not only for children, even for the adults. Once they have loose motions, vomiting, they have to learn how to do the hydration. Ultimately, what is a suggestion that you would like to give it to the parents? Because they have some myths and some ideas, and with wrong notions, they may prepare in a wrong proportion. So what is your advice for that?
So ORS is a life-saving medication. So ORS is a life-saving home thing which should be there at every house. It is not like when there is diarrhea, we'll go and bring, because for everyone, for small children till the elderly adults, we can give to everyone. So always keep one ORS packet with you, especially when you are traveling. And there is a specific proportion to make it, because all this idea depends on you should give specific amount of sodium, glucose, potassium, and water so that it will be absorbed like a pump. So there should not be any variation. Commonly, what we Indian households do is, why to waste a whole packet of ORS when the child drinks only maybe half glass of that.
Glass or one
Half
glass.
glass
Yes.
of that. So let's take 2 to 3 spoons of ORS from the packet, put it in 1 glass of water, then let's give to the baby. This will create more harm to the child than giving benefits. So that's
Oh.
why it is very important that you should prepare in a specific amount, because it is made that in 1 liter of water, if you mix that pouch of glucose, that pouch of ORS, then it will be specific amount of sodium and glucose which needed for the body. In case you increase the amount of ORS, then it will create more of sodium. The body will have hypernatremia. If you put more water, then it will have hyponatremia. So diarrhea might increase, and the patient will have very serious side effects of these sodium abnormalities. That's why it is important. You should always read the instruction. There is a small pouch of ORS also comes with, which is written as 200 ml of water. There's a big pouch of ORS which says 1 liter of water. So always read the instruction and follow the instruction for specific amount of water and the whole pouch of the ORS.
Okay, so thank you very much, Dr. Arun Kumar. You have given such a simple solution to such a great problem, and that too cost free, and it is so easily prepared and can be given also. So thank you very much.
Thank you. Thank you.